I grew up in what I call a normal family, a mom and a dad, 3 younger brothers, Irish Catholic. And we moved to a nice big, suburban area outside of Detroit when I was 15. And a boy at school just started paying a lot of attention to me. I developed a crush on him, like most 15-year-olds would. But my parents were very strict and I wasn't permitted to date until I was 16. And one day, like 6 months later, after school, he asked me if I wanted a ride home from school. In my 15-year-old head, I thought, he's gonna take me home. Like, this is not a date. It's safe, I know him, I go to school with him, I go to the same church as he does. He took me to his house, said, I just have to grab something fast, and I fell for it. And, he offered me to go inside. And at first I said, no, I'm not gonna go inside. But then he convinced me. He just said, I like you. And that was really all that it took. I was drugged and then raped. And that afternoon, my life changed forever.
When someone's trafficked, that's the trauma is incredible. You see them with untreated STDs, multiple pregnancies and abortions. So this is a big medical issue. There was 88% of survivors that were interviewed stated that they sought medical treatment while they were being trafficked, but they weren't identified as traffic victims because the healthcare system didn't know what to look for. Part of the issue is they didn't know what to do with them if they identified. And that's common for what we hear, but we can't turn a blind eye because there's more and more and more victims. And there's people who need us, and that journey is a long journey to healing. And a lot of it has to do with medical and mental health. And that's where we step in. That's who we are. It's who CareSource is. So for us, we have to understand that this is where we are. This is a day and age.
People don't know. People don't like to talk about it. People don't see it, even when it's in front of their faces sometimes. And it's very difficult to identify victims of human trafficking, especially from a health plan perspective. So for CareSource to decide, we are going to make that investment and that effort and try to save those kids, especially as it relates to members who are the most vulnerable. And victims of human trafficking are our most vulnerable members. They do not have people looking out for them. They don't usually even have, parents looking out for them. So when we go into a state and we see where the problems are as it relates to human trafficking, we look outside and we see who is already doing this work and then how we can help strengthen them and where we can fill in the gaps. Folks are already doing this good work and we're here to help them continue that and also stand alongside them and see what we can do from a payer perspective to help these kiddos. So every state is different. You really have to understand, what policy you can influence and work with all of those tools to build that package that best suits that state.
I was lucky enough to be on CareSource. It wasn't why I was a victim, but it was actually as I was a single mom, had gotten out of a domestic violence marriage, was working as a social worker, but not making very much money, and I qualified for CareSource. And it really was a saving grace to be able to have good health coverage for my children, and to be able to, get some care for myself that I hadn't gotten yet. It was a big relief off of my shoulders that I wouldn't have to worry about that and that I could still take care of myself and my kids. It makes my soul really happy to know that CareSource cares this much about human trafficking to even do this. That means a lot. I know so many, hundreds of survivors, men and female, and they struggle every day. And to be able to tell them there is a company out there that you can get services from will help make them have a better quality of life.
Helping fight human trafficking is at the heart of what we do at CareSource and embodies the essence of leading with heart.
It's so important that people become aware, that they understand what it looks like. And we have to really understand that these are just people who've been victimized. So I say, put the what ifs away and let's start embracing it. Let's start calling it what it is. Let's start listening to survivors, and let's start getting these people the healing they need.